planet Earth, chances are you've probably experienced a headache at some point of your life. But have you ever experienced a migraine? In this film, I will explain exactly what migraine is and what you can do to limit or even prevent the symptoms. So what exactly is a migraine? According to the Mayo Clinic, migraines are not well understood and may be caused by a variety of things, including changes in the brainstem or chemical imbalances in the brain. And it's important to understand that a migraine is not just a regular headache. Migraine is connected with a severe form of headache. A migraine attack often starts as a dull headache, which then develops into a throbbing pain, mostly on one side of the head. This pain can spread further to the neck and shoulders. Migraine is typically divided into two main categories, those without aura and those with aura. Aura can actually cause people to have difficulty speaking, hear sounds or music, shake uncontrollably, experience visual disturbances like bright spots, zigzag vision, light flashes, or even vision loss, and can even cause people to go numb in face and body. A migraine without an aura causes severe pain on one side of the head. A migraine with aura causes severe pain with wavy lines and flashing lights. There are several types of migraine, and each has different symptoms. An ophthalmoplegic migraine creates a severe headache in the eye region. A hemiplegic migraine causes severe weakness or paralysis on one side of the body, and a vestibular migraine causes dizziness and vertigo.
There are 4 stages of migraine attack. The first one is prodrome. Symptoms include difficulty concentrating, fatigue, and sensitivity to light. Second one is aura. 20% of migraine sufferers only experience this stage. The third one is headache. Usually one-sided headache with nausea or vomiting and sensitivity to light. The last one and the fourth one is postdrome. Most migraine sufferers compare the postdrome to a hangover, feeling tired with mood changes and weakness.
Migraines are believed to be caused by changes in the chemicals of the brain. Serotonin is a chemical produced in the brain which affects good moods. During a migraine, serotonin levels decrease and make the blood vessels in your brain contract. This causes them to become narrow and can bring migraine symptoms. Following this, the blood vessels dilate again, which causes the headache. Hormonal triggers. Migraines affects 1 in 4 women and 1 in 12 men in the UK. Fluctuating levels of hormones are believed to be a large factor in migraine. Women are more likely to have an attack before they menstruate. This is due to the estrogen levels decreasing before a woman has her period. Emotional triggers. Stress, anxiety, tension, depression, shock, and excitement are all emotions that can bring on migraines. Physical triggers. Tightness, lack of sleep, poor posture, tension, low blood sugar, menopause, shift work, and traveling for long periods of time are all physical factors believed to bring on migraines. The next one is dietary triggers. Blood sugar levels tend to fall when you miss out on regular meals. Sugary snacks can often cause levels to shoot up suddenly. This unevenness is thought to trigger migraines. Lack of food, irregular eating, dehydration. Alcohol, food additives, caffeine, and certain foods such as chocolate and cheese are also known to trigger migraines. Environmental triggers. Bright lights, thickening screens, loud noise, strong smell, climate changes, smoke, and stuffy atmospheres are also need to bring on migraines. Medical triggers. Sleeping tablets, the contraceptive pill, and hormone replacement therapies are also believed to trigger migraines. If you suffer from constant migraines, speak to your doctor about treatment. Options are available to you. Now let us proceed to the risk factors of migraine. The first risk factor is family history. If you have a family member with migraines, then you have a good chance of developing them too. The next risk factor is age. It can begin at any age, though the first often occurs during adolescence. Migraines tend to peak during your 30s and gradually become less severe less frequent in the following decades. The third risk factor would be sex. Women are 3 times more likely to have migraines. Next is hormonal changes. For women who have migraines, headaches might begin just before or shortly after onset of menstruation. They might also change during pregnancy or menopause. Migraines generally improve after menopause. Now let us proceed to the treatments for migraine. Many medications have been designed to treat migraines. Medications used to combat migraines fall into 2 broad categories. The first one is pain-relieving medications, also known as acute or abortive treatment. These types of drugs are taken during migraine attacks and are designed to stop symptoms. Next one is preventive medications. These types of drugs are taken regularly, often daily, to reduce the severity or frequency of migraines. Your treatment choices depend on the frequency and severity of your headaches, whether you have nausea and vomiting with your headaches. There are various ways to treat or even prevent migraine. In order to limit the seriousness, length, and frequency of migraine, a regular lifestyle is crucial. Eat, sleep, and move regularly. It is also important to avoid or limit stress. Migraine sufferers can also get to know their personal triggers and then learn to anticipate them. In addition to good hygiene, medicine can also be prescribed to treat or relieve migraine. There is acute and preventive medication. Acute medication fights the pain directly the moment it surfaces it, and you have more than 2 or 3 migraine attacks per month, then preventive medication can help to limit the number of attacks and their intensity. Ask for your doctor for advice. Migraine can be very painful and can seriously hinder daily activities, so never say just a headache about migraine. That's all for my video. Thanks for watching.